Hi everyone, it's Erin. Just doing a quick video because I just got back from, well, not just got back, I've been at the hospital all day. This morning I had an appointment with a blood specialist, and the reason I had the appointment was because a few years ago, when I was on the pill, I developed a DVT, or a deep vein thrombosis, and what that is essentially is a major blood clot. So basically it was in my main artery that runs from the top of your body to your leg, and my leg at the time swole up, it got hard, it got cold, I had to go to emergency and they shot me with blood thinner and told me to get off birth control at that time, and I could never go back on. So because my blood clot was estrogen related or hormonally related, being pregnant is obviously your hormones are at an all-time high. So because of that, I had to see the specialist to see if it made sense for me to be on blood thinners. So I saw her this morning and she prescribed me, and don't mind my hair. I pulled my hair out and I don't even have makeup on, and I've been crying all day because it's just been a very woe is me kind of day. And I'm an extremely positive person, but I've had an amazing pregnancy, and now that I have to do this, it's just so disheartening. And I'm trying to see the positive in it, knowing it's not, it's gonna not kill me. Anyway, I'll get to all that in a minute. So my doctor prescribed me Fragmin. I'm just going to keep the label off the screen, but Fragmin, it's a blood thinner, and I have to administer this to myself now once a day up until 20 weeks, and then twice a day up until the time I deliver, and then I go back to once a day for 6 to 8 weeks after my pregnancy. And then when all of that is done, they're going to run some tests to see if I do indeed need to be on a constant blood thinner, preventative. So basically this blood thinner prevents me from getting any blood clots during my pregnancy. The needles themselves look like this, if you can see them. So it's got the tip part, the medicine part, the pusher part, and yeah, you basically administer it in your abdomen area or in your thigh, and I have to do it myself every day. So I had to go to the hospital today. I had to go back to the hospital after I had my prescription filled for her to teach me how to do it. So I was all prepared. I was you know what, I'm just gonna be brave. And she put the needle in, which was fine. It didn't even hurt. That part I was okay, I was totally okay with it until she pushed the liquid into my skin. And when she pushed the liquid in, it burned so bad. It made me cry. And I have a really low pain threshold, but still, it made me cry. I was sitting there looking at her crying, and I'm I'm so sorry, I'm crying. And she's it's okay, are you okay? So anyway, it sucks. It sucks. I have nothing positive to say about this. I'm trying really hard. But the reason that I have to do it is because if I get a blood clot, it could kill me. It could kill me, it could kill the baby, and that's just not an option. So the blood thinner will help to prevent that. But now I have to be closely monitored. So I have to go back in a month and do a whole new set of blood work. Oh, they also did that today too. So I had a little blood work done, 13 vials of blood work done. So to go back in a month, and from this point forward they have to monitor me very closely. And then I may end up having to have a scheduled induction because you can't be on blood thinner when you go into labor, or else you could hemorrhage. So they can do two things. They'll either schedule an induction, so I'll know when I go in and they'll induce me, etc., so I can stop taking the blood thinner in time. Or if I go into labor and I've taken blood thinner, then they'll give me a reverse blood thinner to thicken my blood so that I don't hemorrhage and die, because that would be fantastic. Note the sarcasm. So anyway, it's not the best news ever. The needles suck so bad, and I've had, like I said, I've had such a fantastic pregnancy that it just really sucks. But the reason I want to do the video is to update you all, but then also just to say that if you have had any previous blood clots, and your doctor, because my family doctor did not look at this at all. She did not mention it. She did not look at this. When I transferred to my OB/GYN, it was the first thing that she did. She was like, we have to get this looked at right away. So if you've had a history of blood clots, ask your doctor what you need to do now that you're pregnant, especially if your blood clots were hormonally or estrogen related. Because, yeah. So that's where I'm at. Kind of sucky. But tomorrow we have our 3D ultrasound where we hopefully find out the gender. So that's exciting. But I'm just having like a very down feeling day. So I'm trying not to. But anyway, before this gets any longer, I'll say goodbye. And I'll have a video for you tomorrow of the ultrasound and the gender. And on Saturday, I'll be doing my pregnancy 18-week update. So see you all soon. Bye.